Good morning. I will call Senate Finance to order. And Committee Secretary, would you please call the roll? Thank you.
Senator Cannizzaro, Senator Goycochea, Senator Harris, Senator Neal, Senator Wynn, Senator Severs-Gansert, Senator Titus, and Chair Dondero Loop.
Here. Thank you very much. And please mark those present as they arrive, because we will have, I think, some people in and out to do bills, and that's fine. All right. We have several bills on the agenda today. We're going to pound through them like we normally do. So hang on to your hats and buckle your seatbelts, and we'll start with Senate Bill 9. And I believe Senate Bill 71 is also a Department of Ed. So if you'd like, we'll kind of do those together, and you can be excused from class when we're done. So welcome, and please begin when you're ready. Thank you.
Good morning, Chair Dondero Loop, members of the Senate Finance Committee. My name is Craig Satuki for the record, and I currently serve as the Interim Deputy Superintendent for Educator Effectiveness and Family Engagement. Today I'm presenting Senate Bill 9 on behalf of the Department of Education. This bill was pre-filed on behalf of the Department of Education, but this bill was truly filed on behalf of our school districts who requested a streamlined and efficient approach to reports and assessments. As previously closed in budget hearings, this Senate Bill 9 has the removal of the end-of-course assessments from our high school system. That budget closed with no funding. If Senate Bill 9 passes, there is no financial impact. I stand ready to answer any questions on the bill in its entirety.
Thank you very much. Any questions from any of the committee? Okay, seeing none, we'll go to support of Senate Bill 9 here in Carson City, in Las Vegas, and on the phones, BPS. Thank you very much. When you're ready.
If you would like to testify in support of SB 9, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of SB 9, please press star 9 now. Chair, your public line is open and working, and you have no callers at this time.
Thank you very much. We'll go to opposition here in Carson City, Las Vegas, and on the phone lines, BPS, when you're ready.
If you would like to testify in opposition of SB 9, please press star 9 now to take your place in the queue. Public line is open and working. There are no callers at this time.
Thank you very much. We'll go to Carson City. Ms. Hanson, go ahead when you're ready.
Thank you, Madam Chairman, members of the committee. My name is Janine Hanson. I'm the state president of Nevada Families for Freedom. We spend a lot of money on education, and a lot of times we're disappointed in the outcomes. I think one of the reasons for that is the lack of transparency and a lack of accountability. This bill harms both of those things. One of the things that it does is it makes an end to end-of-course exams. They have been shown to help students succeed, not only in graduating from high school, but in going on later to college. I think it's a mistake to eliminate end-of-course exams, which this particular bill does, because we want to do all we can to have our students succeed. And that's really so important in our schools. We wonder why we fail, but we don't change the way we do things enough to help our children succeed. Another issue in this is taking out the requirement that they contact parents. We're always talking about the fact that we want parents involved, but then this eliminates the requirement that parents be notified by the schools of failure or success or certain problems with their children. I think that's a very bad policy to make. We want to include parents more. I know a lot of times the schools might think especially very active parents are an annoyance, but the most active parents of all are the most important parents of all, and we need to engage them and get them involved with their students, involved with the schools, and I think that will help the schools and the students to succeed. So I think these two parts of SB 9 will not encourage success in our schools, will not help our children succeed, but will hurt them and hurt our schools and hurt the success for our children. So I would ask you on those two sections to reconsider and not pass that as a part of SB 9. Thank you.
Thank you very much for being here today. And we'll go to neutral here in Carson City, neutral in Las Vegas, and we'll go to the phone lines. BPS, when you're ready.
If you would like to testify in neutral for SB 9, please press star 9 now to take your place in the queue.
Chairwoman, this is Lynn Chapman, and I didn't hear an opposition. I'm actually speaking in opposition.
Go ahead, please.
Okay, I'm sorry. This is Lynn Chapman, and Madam Chair and Committee, I'm the State Treasurer of the Independent American Party. As parents, we want the best for our children. We pay all sorts of taxes to achieve the end goal of having children who can read, write, do math, and think for themselves. SB 9 is not the bill that would help to achieve these goals. It makes parents wonder why all the money they spend in education, especially when transparency and accountability will be eliminated if the end of course finals are gone. Also, why would the standardized form used in elementary schools be eliminated? This makes no sense at all. Parents want to be informed of their children's achievements, their homework, information from the schools about policy changes and general information, and most importantly, messages from their children's teachers. Why would all this be hidden? Why would parents be left out of their children's education? Shouldn't the schools want parent participation? Of course they would, but SB 9 would eliminate all of this. And if you look at the opinions sent in on this bill, so far support is 17%, but opposition to this bill is 80%. Please vote no on SB 9. Thank you.
Thank you very much for joining us today. Anyone else in neutral on phone lines?
Good morning, Chair and Committee. My name is Jim DeGraffenreid, DeGraffenreid. I am Nevada's Republican National Committee man and in opposition to SB 9 this morning. I echo the comments of Ms. Hanson and Ms. Chapman. In a state where we are as far behind as we are in education, eliminating things like final exams makes no sense whatsoever. And we urge the committee to not adopt this bill. Thank you very much.
Neutral, please, on the phone lines.
If you would like to testify in neutral for SB 9, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. Mr. Statuki, do you have some closing comments, please?
Madam Chair, members of the Senate Finance Committee, Craig Statuki, Interim Deputy Superintendent for Educator Effectiveness and Family Engagement. For the record, I do not have any additional comments for you at this time.
Thank you very much. Senator Neal has a comment, please.
Thank you, Madam Chair. So can you just quickly state in Section 4, it still has parent involvement?
Madam Chair, through you to Senator Neal, Craig Satuki, Nevada Department of Education's record. There is family engagement. What that removal does is remove a prescribed form from that communication, so that is more of a natural flow of communication between educators and the parents. And also in SB 9, we remove essentially a parent report card where teachers are grading parents on their involvement, which is not necessarily the best way to foster a two-way communication between parents and parents and educators about their students' well-being.
But the bill still allows the state board, in order to develop their parental involvement and family engagement policy under NRS 392.457.
Just 1 second, Madam Chair. Madam Chair, through you, Craig Satuki, Department of Education, to Senator Neal, that is correct. So we're still in compliance with the requirements of our title programs in terms of making sure that our teachers are engaging with parents. We're just removing the prescribed form for that piece.
Thank you very much for those questions. And I can just tell you, as a 30-year teacher, this is the way I operated. So I did not have anybody telling me I had to talk to parents. I did talk to parents almost every single day. So thank you very much for being here, and thank you for the bill. And we'll close the hearing on Senate Bill 9, and we will go to the hearing on Senate Bill 71. We're going to skip ahead and let Mr. Statuki take another time at this. Go ahead when you're ready, please.
Good morning, Madam Chair, members of the Finance Committee. Craig Satuki, Interim Deputy Superintendent of Educator Effectiveness and Family Engagement for the Nevada Department of Education, for the record. Based on the amendment in Senate Bill 71, it is based on our current interpretation of the revision, we believe that we would remove this fiscal note because it is now combining a task force. Instead of having two separate task forces, it's now moving some of those members into a single task force that already exists. And I stand ready to answer any questions that you may have.
Thank you very much. Mr. Statuki, would you please confirm that you are actually removing that fiscal note? Because I was under the understanding that it was being reduced to $5,000 or something around that.
I'm going to phone a friend.
Phone a friend in the audience. Thank you and welcome to the table.
Megan Peterson, for the record, Deputy Superintendent for the Student Investment Division. Our apologies, that's correct. We are requesting member travel, but it does remove the remainder of the fiscal note.
So will that be a $5,000 fiscal note or more?
Megan Peterson, for the record, that's correct, $5,400.
Thank you very much. I appreciate that information. All right, any questions or comments about this bill? Ms. Peterson, before I go on, I'm just going to correct, because I have something in front of me that says would be reduced to $5,998 per year, and I realized the 998 makes it almost $6,000, so I'm just correcting to make sure that I have the right information.
Megan Peterson, for the record, yes, that's correct.
Okay. I know, it's details, huh?
Yes.
All right, thank you very much. Any questions, comments on this bill? All right, with none being had, we'll go to support on Senate Bill 71. Here in Carson City, in Las Vegas, on the phone lines, BPS, when you're ready.
If you would like to testify in support of SB 71, please press star 9 now to take your place in the queue. The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to opposition here in Carson City, Las Vegas, and on the phone lines, BPS, when you're ready.
If you would like to testify in opposition to SB 9, please press star 9 now to take your place in the queue.
We're on BPS. We are doing Senate Bill 71.
If you would like to testify in opposition to SB 71, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. We'll go to neutral here in Carson City, Las Vegas, BPS, Senate Bill 9, neutral. I'm sorry, Senate Bill 71, neutral.
If you would like to testify in neutral for SB 71, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. And with that, I'll close, unless you have any closing comments, I'll close the hearing on Senate Bill 71. And we will go to Senate Bill 74, Office of the Lieutenant Governor. 24, what did I say? 74. Oh, we're having trouble with numbers this morning. Guess I'm not going to teach math today. Senate Bill 24. Mr. Marlowe, welcome. You were here last night late, and now you're back for more punishment. Go ahead, please, when you're ready.
Hi, my name is Sarah Johnson. For the record, I'm the director of the Office of Small Business Advocacy. I want to thank you for the opportunity to speak on behalf of the office this morning. SB 24 reauthorizes the Office of Small Business Advocacy and allows us to continue serving Nevada's entrepreneurs. With the recent amendment to SB 24, OSBA will utilize ARPA funding instead of state general funds to fund the office for another 2 years. Our office looks forward to the opportunity to report back to this committee in 2 years on the small businesses we've served and improvements we've recommended to ensure that Nevada truly is small business friendly. Thank you.
Thank you very much. And is there any question on the fiscal note or comments? Seeing none, thank you very much.
Madam Chair, if I may.
Oh, go ahead, Mr. Marlowe.
Daniel Marlowe, Administrator for Administrative Services Division, Department of Administration. Just to clarify, we do have the fiscal note on SB 24. However, as Sarah Johnson indicated, in the closing for this budget account, funding was approved or recommended with ARPA funding with general fund appropriation if needed for that. So the fiscal note specifically on this bill can be removed based on the closing.
All right, thank you very much. That makes it easy. Thank you very much. And we'll go to those in support here in Carson City, in Las Vegas, and on the phone lines for Senate Bill 24. BPS, when you're ready.
If you would like to testify in support of SB 24, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. We'll go to opposition here in Carson City, in Las Vegas, and on the phone lines, BPS, when you're ready, opposition.
If you would like to testify in opposition to SB 24, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much, and we'll go to neutral here in Carson City, Las Vegas, on the phone lines, BPS, when you're ready.
If you would like to testify in neutral for SB 24, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. And with that, any closing comments? Okay, with that, we will close the hearing on Senate Bill 24, and we will move on to Senate Bill 455, the Office of the Lieutenant Governor. Again, please go ahead when you're ready.
Daniel Marlowe, Administrator for Administrative Services Division, Department of Administration. SB 455 makes an appropriation to the Office of Lieutenant Governor for the replacement of computer hardware and associated software following the standard EAT schedule, and we have no revisions to the amount indicated in the bill.
Thank you very much. Any questions, concerns with this bill? Thank you very much. Thank you. We'll go to support for Senate Bill 455 here in Carson City, Las Vegas. And you're not in, are you speaking on 455 in Las Vegas?
Hi, Chair. No, I'm not. I'm just here for any questions. For the record, I'm Rudy Pamantuan, Chief of Staff to the Lieutenant Governor.
Thank you very much. Something to do on Tuesday morning. I understand. Thank you.
Absolutely. Thank you for all your hard work.
Thank you. Anyone on the phone lines in support of Senate Bill 455?
If you would like to testify in support of SB 455, please press star 9 now to take your place in the queue. Caller 111, go ahead.
Good morning. My name is Thomas Mayer, M-A-H-E-R, representing Boulder City Hospital, speaking in support of Senate Bill 241. Boulder City Hospital is unable
Mr. Mayor,
to, and therefore does not.
Mr. Mayor, we are not on.
Yes,
we are not on Senate Bill 241 yet. We are on Senate Bill 455. Would you like to hang on, and we'll get there in just a minute?
Yes, thank you.
Thank you very much, sir. BPS, is there anyone else on the line?
There are no callers choosing to testify at this time.
All right, we will go to opposition. 455 in Carson City, in Las Vegas. On the phone lines, BPS, when you're ready.
If you would like to testify in opposition to SB 455, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. And we will go to neutral here in Carson City, in Las Vegas, and on the phone lines, BPS, when you're ready.
If you would like to testify in neutral for SB 455, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. Any closing remarks? Thank you very much. We'll close the hearing on Senate Bill 455, and we will open the hearing on Senate Bill 241. Please go ahead, Senator, when you are ready.
Good morning. Hello, Chair Dondero Loop and members of the Nevada Senate Finance Committee. I am Senator Dr. Robin Titus, and I represent Nevada Senate District 17, which includes 6 rural Nevada counties: Douglas, Lyon, Churchill, Mineral, and Esmeralda County, and part of Nye, specifically Tonopah. At the table with me, I have Blaine Osborne, who is the next in line to be the director of the Nevada Rural Hospital Association. Thank you very much for allowing me to present SB 241 today. The bill before you concerns our critical access hospitals, of which there are only 13 in this state. 4 of these are in my Senate district: Banner Churchill Community Hospital in Fallon, Carson Valley Health in Garnerville, Mount Grant General Hospital in Hawthorne, and South Lyon Medical Center in Yerington. That is one of the many reasons this bill is very important to me. The policy of this bill was presented to the Senate Health Care Committee on March 21st with a discussion on what a critical access hospital is, as well as what swing beds are. But we are here, we can answer those policy questions if you would like when we finish here. Of note is that all members of the Senate Health and Human Services Committee have agreed to be sponsors of this bill. They all see the importance. SB 241 finance component itself is very straightforward. And if you look at the bill, Section 1 requires Nevada Medicaid to pay these critical access hospitals at their cost for providing outpatient services and swing bed services to Medicaid beneficiaries. Currently, Nevada Medicaid does this for all critical access hospital inpatient services, but not outpatient. This will come at a cost to the state, which is what we are here to discuss. Pursuant to 42 CFR 413 of CMS reimburses critical access hospitals at cost for Medicare benefits for both inpatient and outpatient services, including swing beds, and allows for state Medicaid programs to do the same. CMS does this because they realize it is vital to keep these small rural hospitals open and provide services to their communities. Cost-based reimbursement does not make a profit for the hospitals, but acknowledges that they also should not be taking a loss for providing services to our Medicare and Medicaid recipients. They are simply paid what it costs them to provide services to their community, and it does not include any cost of physicians or other professional services. In any given year, about 25% of all critical access hospitals in Nevada have a net loss operating revenues. This bill will go a long way in ensuring we don't have any of our critical access hospitals in Nevada at risk of closing, and that they remain in the communities providing access to care for our Medicaid beneficiaries. Regarding the fiscal note, you should have that in front of you. The Governor's Office of Finance listed the monies as a total of $2,601,208 for the fiscal note of 2023 to 24, and $6,740,840 for fiscal year 2024 to 25. With that, Madam Chair, we are happy to take any questions you might have, and if you have a policy question, we are happy to answer that too.
Thank you very much. Are there any questions from the committee? I don't see any.
Okay.
Thank you very much. And with that, we'll call for support of Senate Bill 241 here in Carson City. Good morning and welcome.
Good morning, Madam Chair and members of the committee. I'm Joan Hall, President of Nevada Rural Hospital Partners. Critical Access Hospital is a designation given to eligible hospitals by CMS. This provides us with Medicare, outpatient, and inpatient reimbursement. An important piece of unfinished business was that Congress left it up to states to determine how to reimburse for Medicaid. If Medicaid currently pays us cost for inpatient services, this bill would allow cost for all services for Medicaid, Medicaid recipients. On behalf of our 13 critical access hospitals, we urge your support.
Thank you very much. Go ahead, please.
Good morning, Madam Chair, members of the committee. Michael Flores on behalf of the University of Nevada, Reno and our Office of Rural Health, and we are in strong support. Thank you.
Thank you very much. Any additional support here in Carson City? Please go ahead when you're ready.
Good morning, Madam Chair, members of the committee. Allison Jenko, Public Health Resource Officer to Governor Lombardo, for the record, here today in support of Senate Bill 241. The governor would like to thank Senator Titus for her work on this bill, and we look forward to its passage. Thank you for your time.
Thank you very much. Go ahead, please.
Good morning. My name is Patrick Kelly. I'm the CEO of the Nevada Hospital Association. In calendar year 2022, almost half of the hospitals in the state of Nevada had a negative operating margin, and many of those were critical access hospitals. This bill will go a long way to shoring up and creating a stable environment in which these hospitals can exist. So we would urge your support. Thank you.
Thank you very much. Any additional support here in Carson City? In Las Vegas, seeing none. BPS, when you're ready on the lines.
If you would like to testify in support of SB 241, please press star 9 now to take your place in the queue. Caller 111, go ahead.
Good morning again. My name is Thomas Mayer, M-A-H-E-R, representing Boulder City Hospital and speaking in support of SB 241. Boulder City Hospital is unable to and therefore does not accept almost 600 Medicaid referrals per year from urban acute care hospitals for their patients needing subacute placement in our swing beds due to the incredibly low rate of Medicaid reimbursement. We can be a better partner to our urban Clark County hospitals and increase access for life-saving medical intervention if we can receive cost-based Medicaid reimbursement for these subacute patients and free up those acute beds at the metropolitan hospitals for sicker patients. Critical access hospitals are what the name implies, hospitals that have critical need for access, especially in an emergency. Our ER visits are relatively low, but our presence is essential. Cost-based Medicaid reimbursement gives us a fighting chance to remain financially viable and take care of our rural communities. And that doesn't even begin to address the need for improvement in our physical plant, equipment, and infrastructure. Federal law requires that we treat and stabilize anyone who arrives at the ER regardless of resources. Currently, we receive 11 cents for every dollar of cost to provide these services. This is not sustainable for our critical access hospitals. Thank you for your consideration.
Thank you very much. Next caller, please.
Yes, this is Kelly Adams, CEO at Mesa View Hospital in Mesquite, Nevada. We are a critical access, 25-bed critical access hospital serving the community here in Mesquite, Logandale, and the surrounding area. Population of this area is about 22 to 23,000 people. I am here to speak in support of SB 241. Last year, this hospital was only at less than a 1% margin, and we have employees to pay, supplies to buy, a number of things. And so I'm very much in support of SB 241 for swing bed subacute as well as outpatient to get us up at least where we can cover our costs. Thank you for your time.
Next caller, please.
Caller 301, go ahead.
Good morning. This is Tony and Sarah. I am the CEO of Southline Medical Center. We are a 14-bed critical access hospital located in Yerington, Nevada. We serve the rural areas of Smith Valley, Mason Valley, and the communities of Mason, Schurz, and Topaz Ranch Estates, a population of over 14,000 lives. With very low commercial payers, SLMC relies heavily on reimbursement from Medicare and Medicaid. Our facility treats many retired individuals as well as thousands of low-income families and farm workers. Medicaid pays our facility significantly less than our costs for outpatient services. Our costs of these services are 36% of the billed charges, but Medicaid pays only between 9 and 11%. For example, in the last fiscal year, we billed Medicaid just over $3 million for combined outpatient services, and were paid just $261,000, which was $827,000 less than our cost to provide the service. Outpatient cost-based reimbursement is the safest, surest way for rural hospitals to receive fair reimbursement and continue our viability. I urge the committee to support SB 241. Thank you.
Thank you very much. Next caller, please.
Caller 461, go ahead.
For the record, I am Denise Ferguson, CEO of Mount Grant General Hospital in Hawthorne, Nevada. Madam Chair and members of the committee, I am in support of SB 241. As a rural hospital, our community's sustainability is dependent on our hospital's existence. Currently, 33% of our outpatient and ER visits are comprised of Medicaid beneficiaries. This has continued over the recent years and is necessary to support the needs in the community we support. This also includes Tonopah, whose critical access hospital was closed 7 years ago, and we are the closest facility to those residents in need. On average, we have a loss of anywhere from $1.5 to $1.8 million per year due to outpatient Medicaid reimbursement. The support of this bill will ensure we are able to support our community, its members for the future, that we continue to have access to care where currently transportation is our biggest obstacle, but we are unable to fund this due to our reimbursement. We also need to recruit skilled workers to our area in order to continue to compete in our market. We greatly appreciate your support on this bill. Thank you for the opportunity to speak on behalf of rural hospitals and our community today.
Thank you very much. Additional callers, BPS?
Good morning. This is Melissa Rao, the Administrator of Grover C. Dills Medical Center in Caliente, Nevada, and I support Senate Bill 241. With our current payer mix in Lincoln County being over 25% Medicaid, you can see that these numbers do have a direct impact on our critical access hospital as well as our clinics. Receiving cost-based reimbursement for outpatient services would be significant and allow the continued stability and access to services for Medicaid recipients. Also, the opportunity to reinvest in this already underserved area of Nevada. This is vital to Lincoln County and will allow us to bring stability in health care to those living and visiting our community. It's also important for me to note that the closest medical facilities to Lincoln County are in St. George, Utah, which is 115 miles away, and Las Vegas, Nevada, which is 150 miles away. These drive times are at least 1.5 to 3 hours. Access to care in Lincoln County is essential, as this is a community that is underserved, aging, and we provide primary care to our elderly population who cannot leave or choose not to leave Lincoln County for their health care needs. We serve a wide and diverse group of visitors, and we love the community that we serve. Thank you for your time and consideration of SB 241.
Thank you very much. Next caller, please.
Caller, go ahead.
Hello, my name is Robert Carnahan. I'm a nurse and a CEO of Banner Churchill Community Hospital, a critical access hospital in Fallon, Nevada. Banner Churchill Community Hospital supports SB 241, outpatient cost-based reimbursement. Reimbursement challenges is creating a difficult space to provide care, and we have not seen increases in reimbursement in many years. Having outpatient cost-based reimbursement is crucial to our operations and the ability to continue providing care to our community. We have witnessed extreme cost increases over the past few years in all areas of operations. The areas that are seeing considerable impact are labor, supplies, equipment, and pharmaceuticals. Having outpatient cost-based reimbursement also allows us to put capital dollars and invest those capital dollars back into our facilities. To kind of put this in perspective, in the past few years, we put up a new emergency department to support our community at a cost of $9 million. We recently put in a new MRI at a cost of $3 million. We had to buy a new ambulance this past year, $240,000. And even those things that people don't really see as a medical operation, but then we had to pave our parking lot this past a few years ago at $1.5 million. So you can see the cost of doing business is super expensive. Nevada struggles to recruit clinical staff to our state, and this is even compounded in the rural markets. Having additional funding with outpatient cost-based reimbursement will allow us to better recruit staff at our facility, as the additional reimbursement will help with the increases that we're seeing with labor costs. This is especially evident with doctors, nurses, respiratory therapists, and imaging techs. With the national shortages of clinical staff in our country, we must pay higher wages to remain competitive and draw those much-needed clinicians to our facility. In this last few years, we have seen our margins shrink, and we are barely making a margin in the current economy. This last year, just barely made 1% margin. Our current reimbursement is not keeping up with inflation and these increased costs. Having outpatient cost-based reimbursement will allow us to continue serving Nevadans and those who seek out care with us. As mentioned, it is imperative that additional reimbursement is available and reimbursement that would be beneficial to our operations. Thank you much.
Thank you very much. Next caller, please.
Caller, please.
Hello, my name is Jason Blake. I am the administrator and CEO at Battle Mountain General Hospital. Last name is spelled B-L-E-A-K, and I appreciate the opportunity to testify in support of SB 241. As a critical access hospital in one of the least populated counties of Nevada, we do not have a patient volume to make up for operational losses due to governmental reimbursements. The Center for Medicare and Medicaid Services took important steps years ago to create a critical access hospital designation and establish a cost-based reimbursement structure for Medicare services. I feel that SB 241 is an essential reimbursement modernization bill to sustain Nevada's rural hospitals. By improving SB 241 and establishing a similar payment structure to CMS, this legislature will be recognized for utilizing state resources to ensure healthcare stability in the rural areas of Nevada. Medicaid and Medicare patients represent a little over 50% of our patient revenues. By passing this bill, the future of Battle Mountain General Hospital will be strengthened as the various costs of care continue to rise. This will give us the opportunity to better recruit and retain licensed and certified clinical staff, as well as other support staff. It will also allow us the opportunity to maintain our medical equipment with updated technology and capabilities. All critical access hospital patients will be benefited by passing this bill. Again, I want to thank you for this chance to testify in full support of SB 241. Thank you.
Thank you very much. Next caller, please.
Caller, please.
Good morning. I'm Brandon Shattuck, spelled C-H-A-D-O-C-K. I have the privilege of being the administrator of Pershing General Hospital and Nursing Home. Pershing General is the sole healthcare provider in Pershing County for primary care, emergency care, diagnostics, and long-term care. We are located an hour away from other healthcare services along I-80. Nearly a decade ago, the hospital nearly shuttered, and while much effort went into their financial turnaround, their story is not unique. Unfortunately, many critical access hospitals face similar challenges year after year, operating on slim margins that hinder physical plant, equipment, and service line reinvestment. Rural hospital closures are increasing nationwide, but Nevada can reverse this trend by adopting innovative approaches like SB 241. Supporting this bill would help PGH stabilize its facility and reinvest in services. Over the past year, we've added certified wound care and explored a mobile rural health clinic in partnership with our county to care for underserved rural populations that are typically Medicaid or Medicare. In 2022, PGH won a nationwide top 20 in quality award from the National Rural Health Association, so we're doing the very best we can with already slim margins. In 2022, our audited total margin was negative 8.3%, primarily due to the cost of labor and supplies. Because Medicaid members represent a significant portion of the patients we serve, reimbursing those visits based on the cost to provide them care would allow us to strengthen our core services, improve our aging building and equipment, and better address community health needs. I urge you to recognize the significance of this bill from the perspective of Pershing General Hospital and the other cause. While it may not solve all of our challenges, it represents a significant and impactful step forward, a much-needed lifeline at a crucial time for rural hospitals. Thank you for your support.
Thank you very much. Next caller, please.
Caller.
Good morning, Jeff Prater, CEO of Carson Valley Health, formerly Carson Valley Medical Center. I'm here today in support of SB 241. In our last audited financials, which was 2021, Carson Valley Health had cost, not gross billings, for outpatient Medicaid patients of $4.2 million. Unfortunately, we were only paid $1.7 million. In today's dollars, Carson Valley Health's unfunded cost of providing care to the Medicaid population is $2.5 million annually. In addition to the unfunded Medicaid services we also provide $3.1 million of charity care in 2022 and had a bad debt of $1.6 million. Of the unfunded Medicaid cost, this includes $500,000 of orthopedic surgical implants alone. Carson Valley Health also provides swing bed services within its 23 licensed beds. Medicaid pays us $128 a day, and our costs are approximately $2,800 per day. Other very important services we provide that put additional financial strain on the organization due to our costs that are not covered are emergency services, wound care, oncology treatments, including infusion services and behavioral health. In order to positively impact access to care within our service area of 55,000, it is imperative this bill move forward. Our patients, like many other rural areas across the state, want their health care close to home. Thank you.
Thank you very much. Next caller, please.
Hey, I'm Matthew Walker, CEO at White Pine County Hospital District. I'm calling in support of SB 241. I don't have a lot to add to what has already been said. Here in Ely, we're pretty rural. We're 200 miles to the nearest healthcare, 230 miles to the nearest tertiary center, so it's about a 3.5-hour drive one way. Our organization is imperative for the healthcare of people that live in and travel through this area. Wanted to testify that outpatient cost-based reimbursement, although won't fix the entire problem, but it will certainly help and allow us to continue to provide services to our most at-risk population. The number of Medicaid patients that we have in this area continue to increase, and the reimbursement is far less than what it costs to provide services. Because of this discrepancy, it requires us to look at some of the services that we provide, such as our OB services and oncology services, and whether or not we can continue to provide them. Our hope is that with some outpatient cost-based reimbursement, we will be able to offset some of those losses and allow us to continue to provide those life-saving services to those who really don't have another option because they don't have reliable vehicles or the means or opportunity to leave the area to receive health care anywhere else. Again, I appreciate you listening to us, and I hope you will support SB 241.
Next caller, please.
Caller 500 plus *6 to unmute.
Madam Chair and members of the committee,
I want to talk to you about the importance of supporting SB 241, cost-based reimbursement for outpatient Medicaid services and swing bed services for rural hospitals in Nevada. My name is Susan Davila, and I am the CEO of Desert View Hospital in Pahrump, Nevada. Desert View Hospital sits in Nye County, which covers 18,159 square miles. Most of the county is remote and rural. We have a population, about 20% of our population in Nye County fell below the poverty level, and many of these individuals are on Medicaid and managed Medicaid. Rural hospitals in Nevada have been struggling to stay afloat due to a number of factors, including lack of funding and resources. These hospitals are often the only healthcare providers in our own communities, and they play a very critical role in ensuring that residents have access to quality healthcare services. However, the current Medicaid reimbursement system is not designed to meet the unique needs of rural hospitals. Under the current system, rural hospitals are reimbursed based on a fixed fee schedule for outpatient claims, which does not take into account the actual cost of providing care. This puts rural hospitals at a disadvantage as they often have higher operating costs due to their smaller patient volumes and limited resources. As a result, many rural hospitals are forced to operate as a loss, which can ultimately lead to closures and lack of access to healthcare in the communities that we serve. Cost-based reimbursement for outpatient services is necessary to address this issue. By reimbursing hospitals based on their actual costs rather than a fixed fee schedule, rural hospitals will be able to receive the funding they need to continue providing quality care to their patients. In conclusion, cost-based reimbursement for outpatient Medicaid claims is necessary for rural hospitals in Nevada. It will help to ensure that rural hospitals have the funding they need to provide the quality care to their patients. Let us work together to ensure that all rural Nevadans have access to quality health care services within their own communities. Thank you for your support.
Thank you very much. Next caller, please.
There are no callers choosing to testify at this time.
Thank you very much. We'll move to opposition in Carson City. Seeing none in Las Vegas. BPS, phone lines, please.
If you would like to testify in opposition to SB 241, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. We'll go to neutral here in Carson City. In Las Vegas, seeing none. BPS, phone lines, please.
If you would like to testify in neutral for SB 241, please press star 9 now to take your place in the queue.
Good morning, Chair, committee members. This is Dora Martinez. I was actually calling to support SB 241, please. I'm so sorry.
Go ahead, please. We're on Senate Bill 241.
Yes, thank you. We are calling to support. This is Dora Martinez with the Nevada Disability Peer Action Coalition, and we ditto all the prior callers, and we thank Senator Dr. Titus for this bill. Thank you. Have a great day.
Thank you very much. Any additional callers for neutral?
Good
morning, Madam Chair and members of the committee. My name is Robin Dunkhorst. For the record, I am calling in support. I missed the queue opportunity for support, so I'm hoping I can continue.
Go ahead, please.
I'm the Chief Executive Officer at Humboldt General Hospital in Winnemucca, Nevada. Critical access hospitals support the health of the lives that reside in 87% of Nevada's landmass. Humboldt County is no different than those that you have heard prior, with over 4,000 of our lives that are residents that are receiving Medicaid. On behalf of those underinsured rural residents of Humboldt County, I thank you for this opportunity today to testify in support of Senate Bill 241. To serve and provide thorough access to care for Medicaid patients in our community, it is paramount that critical access hospitals be paid for the cost of delivery of outpatient care and swing bed services. Not only do we sorely lack the resources for mental health, but primary care resources are limited, and most rural counties are primary HIP centers. If you want to improve the disparity of health care in rural locations, it needs to be priority to ensure that access to care in these areas is supported by paying for the cost of the care that's being delivered, so that we're able to afford to develop services and offer at minimum rapid and effective access to primary care as well as swing bed care, so we could rehabilitate our community within our community where they're home. With the escalating inflationary costs and healthcare labor shortage issues, now is the time to offer this level of subsidy before we start to experience possible closure of some rural organizations. Unlike most industries, healthcare cannot pass on the increased cost to the consumer, which isn't a bad thing, but does indeed cause healthcare delivery instability in rural organizations that have nothing left to give. If this bill does not get moved forward, I foresee our organization having to make really horrible decisions, such as closure of our behavioral health clinic, cardiology clinic, obstetric services, and our rural family residency program, just to ensure that we keep the heart of our life-preserving needs intact. These are just a few of the many services that we offer to improve the access to adequate health care that every rural resident deserves, regardless of their ability to pay. And you can help to ensure that this grows and improves. All we're asking for today is that we are paid at cost for the services that we're already providing. We're not looking to make any money here, but just simply break even because it's vital to our sustainability. Thank you for allowing me to speak today, and I urge you to support this bill.
Thank you very much. Anyone else in neutral for Senate Bill 241 on the phone lines?
There are no callers choosing to testify at this time.
Thank you very much. Closing remarks, Senator Titus.
Thank you, Madam Chair and members of the committee. I'll keep this brief. We have heard many issues this session on access to care, and we are looking at many solutions. This particular bill will help us maintain what we currently have so that as we continue to build our infrastructure and provide more providers, we're not going to lose any. I appreciate your hearing the bill today, and we heard from north, south, east, and west in this great state of ours about how important this bill is. So thank you very much for your patience in hearing this bill.
And thank you very much. And I understand the importance of this. It's no secret that I have family in rural counties and have had families in rural counties. And this is why we take care of all Nevadans, and this is why we vote bipartisan on many bills, including those in Las Vegas and Reno. Thank you very much. With that, I will close the hearing on Senate Bill 241, and I will open the hearing on Senate Bill 375, and that's Senator Sievers-Gansert and Senator Canizaro are listed on this, but I believe Senator Sievers-Gansert is going to present for us. So go ahead when you're ready.
Thank you, Madam Chair. As a member of the committee, members of the committee, for the record, Senator Heidi Sievers-Gansert from District 15 in Northern Nevada. And with me I have Dr. Cameron Duncan, who is the Interim Dean of Orvis School of Nursing at the University of Nevada, Reno. Before you have Senate Bill 375, and I was really pleased that Senator Canizaro co-sponsored this, as did Speaker Steve Yeager and Leader P.K. O'Neill. So this truly is a bipartisan and bicameral piece of legislation. This bill is about expanding the nursing pipeline in the state of Nevada. When you look at this, I gave you a couple of things on your desk, or they should have been provided to you. One is a nursing pipeline and fact sheet, which looks like this, and the other one is a white paper that was written by John Packham and a couple of his associates that says, it's titled Addressing Nevada's Nursing Workforce Shortage, a Call to Action, which was published in December of 2022. And I actually started working on this November of last year, recognizing kind of the obvious that we have a nursing shortage in the state of Nevada and looking for ways that we could improve the pipeline to nursing. I immediately, early on, contacted Cameron to see what they were doing at the Orvis School of Nursing. Eventually, I spoke to the nursing deans of the 7 programs that we have. So the money in this bill is in Section 1. It's about $17.5 million the first year, almost $5 million the second year, and the ongoing would be about $18.5 million, though this is one shot. These funds would be basically go to the Nevada System of Higher Education, which would create a grant program for awards to the different institutions. And we do have 7 institutions that have both undergraduate and graduate programs. With these funds, we could increase the number of nursing grads by 50%, and that is on that fact sheet. We can go from about 1,082 nursing grads per year to almost 1,800 graduates per year, which will really help the pipeline. The money when I posed the question to higher ed about increasing the nursing programs, I asked them to see how far they could go with expanding the number of students but not adding space. So there's no capital money in this. This is all about hiring staff, faculty, and purchasing equipment to be able to operate and expand the nursing programs. The dollars that are in this bill can be used in either year, but have to be used through the end of the fiscal year. And I had several conversations with Dr. John Packham, who again wrote the white paper with a couple of his colleagues. Dr. John Packham is the co-director of the Nevada Health Workforce Research Center, which is part of the Office of Statewide Initiatives, which is housed at the University of Nevada Reno School of Medicine. And he's been studying this for quite a while, and he's unable to join us today because he is on a plane. But in addition to the white paper, he sent me some information which I thought was really, really important. So over the past 6 years, the 7 NG RN programs graduated 4,861 students, and they survey those students. And the number of students that replied to their survey was 2,588, so it was a really good response rate. 91.1% reported that they have lined up employment with a Nevada employer, typically a hospital, or plan to begin working in Nevada after they graduate. The 90% nursing program retention rate holds up across academic years, meaning for 6 years he's been studying this, and it has held up to where we have 89.4 to 92.6% retention rates across the 7 institutions. His bottom line, he basically said, expanding the nursing programs and those the students who graduate there will remain in Nevada to begin working. Again, 90% retention rate over the last 6 years, which I think is critically important. I did talk to most. I might have missed the dean at TMCC. I can't remember. I've got all these notes, but I wanted to just give you a couple of little notes. When I talked to June Eastridge at Nevada State College, she said she turns away 200 qualified applicants every year. 200 qualified applicants. And Great Basin, their point of pride, when I talked to Amber Donnelly, was that they have a 100% pass rate. So we have outstanding public schools of nursing. I'm very hopeful that we can fund them so that they can expand their number of graduates by 50% in the next 3 years. Thank you so much for hearing this bill, and I'll turn it over to Cameron Duncan for any comments that he may have.
Thank you, Madam Speaker, and thank you, Senator Ganser, Senator Canizaro, for sponsoring this bill. My name is Cameron Duncan, for the record. I'm the interim dean for the Orvis School of Nursing at the University of Nevada, Reno, and we have the largest nursing program in the north of the NC schools with both undergraduate and graduate programs. Each year, we have a consistent high pass rate on both the NCLEX, the RN exam, and on our APRN nurse practitioner examinations. We have a 100% pass rate. And as she referred to from Dr. Packham, the majority of our graduates are here in Nevada, and they stay in Nevada after graduation. It's clear to everyone that there's a severe nursing shortage, and one step in correcting that is increasing enrollment in our nursing programs, both graduate and undergraduate, going back to primary care needs also for our nurse practitioners. This grant program will really provide additional funding for us that will really help us in increasing enrollment in all of our programs and will allow us to hire more faculty members, recruit faculty members that are highly skilled and qualified from other states to come to Nevada to help us grow, and will also allow us to increase the number of graduate assistants and teaching assistants that we have to support our faculty. This money will also be used to hire additional administrative staff and support staff to help us run our programs efficiently, and will also help us purchase the necessary equipment that we need to provide training and high fidelity simulation to all of our students. And lastly, this money can also be used to support our faculty and faculty development opportunities so that they are using evidence-based teaching strategies and ensuring that we maintain our quality education in all of our nursing programs. So thank you again for your time.
Thank you very much. Any questions or comments from the committee? Senator Wynn.
So is it your anticipation that these funds could be used throughout NC, or would they be like specifically to like the two, I guess, larger institutions, one in the north and one in the south?
Thank you for the record, Senator Heidi Seifers-Gansert. I actually had information from every single, it was a 33-page document. Every single program can expand. Some of them have graduate and undergraduate and graduate programs, but I think a lot of them will be on the line. So it is for all the programs. It's not just fundamentally University of Nevada, Reno, and UNLV. Nevada State College has a robust program, so do all the community colleges across the state. So I'm really pretty excited about this because part of our issue is making sure we have providers across the state, and when you have students that graduate from GBC, they're gonna stay out in the rurals, right? Western Nevada College, TMCC, and then College of Southern Nevada has a very robust program too, so I'm pretty excited that all of them participated, and that's how we came up with the number. Thank you.
When you think about it in terms of that, I've had a lot of conversations with College of Southern Nevada and their representatives. I know that they have a nursing program and a pipeline program that they think fits this mold. Did you anticipate that people would be able to, I guess, is there a priority on how these funds would be distributed amongst those NG or like institutions?
Again, for the record, Heidi Seifers-Gansert. So what they did is they each responded individually. So the dollars that you see is the sum of what kind of their wish list for how they could expand. And what surprised me is I basically said, without adding buildings, how much can you go? They could go to about 67%, but when you look at how they grew, it flattened out after about 3 years. So the reason it's in a grant form is because it's hard for us to write legislation for each program and allocate it like that, but this is basically the accumulation, and Andrew Klinger helped put that together because literally I got a 33-page document in different formats of what they wanted to do and how they could increase their programs. So it doesn't favor one or the other, it's for each of them and how they think they could expand.
So for example, like CSN had a program that was going to cost approximately $1.5 million. Is that $1.5 million kind of allocated in that if they had provided that to you all when you were crafting this legislation? So this I think it's about 31 million. Is that would be included in there essentially?
Yes, thank you for the record, Senator Heidi Seifers-Gansert. Yes, their individual requests were summed, and that's why we have kind of the funny numbers that you see. Is they weren't rounded or anything. We basically added up what each of them requested to be able to expand their programs.
Thank you so much.
Thank you. Additional questions or comments from the committee? Okay, seeing none, we'll go to those in support of Senate Bill 375 here in Carson City. Short and sweet is the note of the day, so much appreciated. Go ahead, please.
Thank you, Madam Chair, members of the committee. For the record, Alejandro Rodriguez with Nevada System of Higher Education. We are in strong support of SB 375. We'd like to thank Senator Seifers-Gansert along with Majority Leader Canizaro, Speaker Yeager, and Minority Leader O'Neill. Thank you very much.
Thank you. Go ahead, please.
Good morning. For the record, my name is Elena Bobnova, Associate Vice President representing Truckee Meadows Community College. I'm speaking in support of Senate Bill 375. We would like to thank the sponsors of the bill for providing additional funding that will allow us to increase capacity in nursing programs and serve the local residents of the Reno-Sparks communities. Thank you.
Thank you. Go ahead, please.
Good morning, Patrick Kelly, Nevada Hospital Association. I'd like to share 2 data points. One is we surveyed all of our member hospitals and asked them on January 1st, 2023, how many open RN positions do you have? And the answer came back over 2,400. That's what we could fill immediately if we had the people. The second data point is there was a study by Vivian Health using federal government data that looked at all the states in the country to see where the greatest increase in demand was going to be for nurses. And Nevada was number 3 in the nation. We're going to have a 23% increase in demand for nurses during this decade. So the need is definitely there, and we really appreciate the sponsors of the bill in supporting this. Thank you.
Thank you very much. Go ahead, please, when you're ready. Ms. Hall, would you please push your button on your microphone?
Sorry. Joan Hall, representing the 13 rural hospitals, so you don't have to hear from each of them again. This is an amazing bill and really worth a lot of consideration. As a nurse, I know the deficits we have in Nevada, and this will go a long ways to providing care to Nevadans. Thank you.
Thank you. Go ahead, please.
Good morning, Madam Chair, members of the Committee on Senate Finance. Anthony Ruiz with Nevada State College. We're in strong support of this bill. As you heard earlier, Senator Sievers-Gazzard is correct. We are at capacity in our current resources, but we hope that this bill will allow us to expand our nursing programs and just urge your strong support. Thank you very much.
Thank you very much. Go ahead, Mr. Ross.
This is George Ross on behalf of HCA, which is Sunrise Children's, Mountain View, and Southern Hills Hospitals in Clark County. We are very strongly in support of this bill. This would really help expand the core of nurses as well as enable us to continue to maintain quality care. Again, and I want to thank very much the sponsors of this bill. Really appreciate it.
Thank you very much. Go ahead, please.
Good morning. Again, for the record, Elena Bobnova. Now I'm here speaking on behalf of Western Nevada College, as they cannot be here for this hearing. On behalf of WNC, I would like to thank you for the support and recognition of the importance of nursing training that WNC provides to address the shortage of healthcare professionals in Nevada. Western Nevada College serves 6 rural counties. Carson City and Fallon campuses house WNC's nursing program and serve as the only pipeline of trained nursing professionals for these local communities. The nursing capacity expansion provided by Senate Bill 375 will allow WNC to train more nurses who will likely stay in those communities, providing health care for rural and tribal populations. If funding is allocated by July 1, 2023, WNC could admit an additional 24 first-year students at 3 college sites in the 2023-24 academic year. These students could be on track to graduate after completing the program in 2025. Thank you for your support.
Thank you very much. Go ahead.
Thank you. Good morning, Madam Chair, members of the committee. Michael Hillerby on behalf of Renown Health. I'd like to thank Senator Sievers-Gansert and each of her co-sponsors for this important legislation. We know that increasing the pipeline and educating Nevada students and keeping them here as the next generation of nurses is probably the most important thing we can do to increase the nursing supply and address the needs you've already heard about. We, again, thank the sponsors and hope you will support the bill.
Thank you very much. Go ahead, please.
Kent Irvin, Nevada Faculty Alliance, ditto to what others have said. This is so important for increasing the capacity. Just another point, to increase that capacity, we have to be able to hire the nursing faculty, and at current compensation rates, that's a very difficult thing to do, and that's why all the compensation packages you are also considering is very important.
Thank you very much. Go ahead, please.
Thank you. Alex Tanchek with Silver State Government Relations, representing the Nevada Advanced Practitioners Association, here in support of the bill. Thank you.
Thank you very much. Go ahead, please, when you're ready. We move fast around here.
Thank you, Madam Chair, members of the committee. For the record, my name is Paige Barnes with the Ferrado Company, here today in support on behalf of the Nevada Nurses Association. Thank you.
Thank you very much. Any additional comments in support? Okay, thank you very much. All right, well, seeing none in Las Vegas, we'll go to the phone lines, BPS, when you're ready.
If you would like to testify in support of SB 375, please press star 9 now to take your place in the queue.
Good morning, Madam Chair and the committee members. This is Dora Martinez representing the Nevada Disability Peer Action Coalition. We want to thank my Senator Gansert for sponsoring this bill. Thank you so much. And we ditto the rest of the prior statement commenters. Thank you. Have a good day.
Thank you very much. Next caller, please.
Good morning. My name is Donna Laffey with Ferrari Reader Public Affairs on behalf of Dignity Health St. Rose Dominican. St. Rose is in support of SB 375. Expanding Nevada nursing programs will help create a much-needed pipeline for more nurses in Nevada. We urge the committee's support and thank the sponsor for bringing this forward.
Thank you very much. Next caller, please.
Dr. Amber Dinelli, Associate Vice President for Faculty Success and Dean of Health Science College. For the record, good morning. I appreciate the opportunity today on Senate Bill 375. I oversee the #1 nursing program in the state of Nevada based on our current pass rates in taking NCLEX. GBC has 4 nursing sites, Elko, Ely, Pahrump, and Winnemucca. We have the ability to expand, but lack the nursing faculty support in order to enroll more students into each of our nursing programs. Their compensation in clinical and private sector settings bring current and potential educators away from teaching. Teachers are a hard-to-come-by commodity, and in rural areas of Nevada, the challenge is just as great. Adding the expansion funding will strengthen, allowing for more nurse educators to role models and providing the leadership needed to implement evidence-based practice. The American Association of Colleges of Nursing reports that having better educated nurses results in better patient lower mortality rates, lower readmission rates, and shorter lengths of stay. However, not having enough nurse educators to build the nursing workforce in rural Nevada will impact the care and outcomes of those that live in our communities. This bill would allow us to expand the nursing program and continue to assist professionals in providing care to our rural Nevada communities.
Next caller, please.
Hi, good morning. This is Frank Woodbeck from the College of Southern Nevada. I was calling to in support of SB 375. We stand ready to put a program into place for the training of practicing nurses to be educators. It's an excellent opportunity for us, and we look forward to its passage. Thank you.
Thank you very much. Next caller, please.
Good morning, Madam Chair and members of the committee. My name is Angela Silvestri Elmore, and I'm the Associate Dean for Undergraduate Education at the School of Nursing at UNLV. At UNLV, we have both undergrad and graduate programs, and as a nurse educator and administrator, I'm here to testify in support of SB 375. In addition to the points already discussed, I wanted to add a point about clinical site constraints and how SB 375 is an important step forward. Clinical site constraints is a barrier to increasing enrollment in nursing programs across the country. Nurse educators have the skills to provide high-fidelity learning opportunities using simulation and case-based learning as an alternate to on-site clinical experiences, but are lacking the resources to do so. Given the constraints on clinical sites, we need the resources to support nurse educators in mirroring clinical practice in a variety of settings. So we are in support of this bill, and thank you for your time.
Thank you very much. Any more callers in support?
There are no callers choosing to testify at this time.
Thank you very much. Anyone in opposition in Carson City? Anyone seeing none in Las Vegas? Anyone on the phone lines in opposition?
If you would like to testify in opposition to SB 375, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. Neutral in Carson City, neutral in Las Vegas, and neutral on the phone lines. Thank you very much, BPS, when you're ready.
There are no callers choosing to testify at this time.
Thank you very much. Senator Gansert, any closing remarks?
Thank you, Madam Chair. For the record, Senator Heidi Seavers-Gansert. First, I want to answer the question by Senator Wynn. CSN was looking at an additional program that would become an accelerated track, like 3 semesters. And they were looking at adding between 80 and 100 students a year on an accelerated track. So they're in here big as far as opportunities to educate. So I appreciate the consideration of this legislation. I know it's significant money, but again, when you look at the study, the 6-year study that Dr. Packham did, 90% of these students stay in Nevada. And because we have outstanding public nursing programs across the state, it will really help raise the number of nursings, the supply side across the state. I'd appreciate your support. Thank you.
Thank you very much for your time today. And with that, I'll close the hearing on Senate Bill 375, and I'll open the hearing on Senate Bill 448. And please go ahead when you're ready.
Good morning, Madam Chair, members of the committee. My name is Robin Hager. I'm the Deputy Director with the Governor's Finance Office. In summary, this bill replaces court assessments in certain executive branch agencies as well as the judicial branch with general fund appropriations, as court assessments have been reducing over the previous bienniums, and I believe this would help support or is necessary to support the budgets that you have already closed. I am happy to take any questions.
Any questions from the committee? Seeing none, we'll move on to support of Senate Bill 448 here in Carson City. Seeing none in Las Vegas, we'll go to the phone lines. BPS, when you're ready.
If you would like to testify in support of SB 448, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. We'll go to opposition here in Carson City, in Las Vegas. On the phone lines, when you're ready, BPS.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to neutral here in Carson City, in Las Vegas, and on the phone lines, BPS.
The public line is open and working. There are no callers at this time.
Thank you very much. And with that, closing remarks, Ms. Hager, none? Okay, I'll close the hearing on Senate Bill 448, and we'll open the hearing on Senate Bill 453.
Good morning again. For the record, Robin Hager, Deputy Director of the Governor's Finance Office. Senate Bill 453 restores the balances in 2 accounts. First, the emergency account created by NRS 353.263 in the amount of $145,237. The second is the state general fund needed to restore the balance in the contingency account created by NRS 353.266 in the sum of $22 million. I am happy to take any questions.
Thank you very much. Any questions from the committee? Senator Neal?
Thank you, Madam Chair. I guess this is the one, this particular bill, or is there a third bill that makes sure that, I know when we had the joint, there was an amount that they were seeking to keep in terms of their balance. Is this the restoration of that? That their current reserves that they had in their account, or is this different? I'm talking about, isn't this the judiciary's bill? No. Okay, never mind. All right, then never mind. Never mind, sorry.
Okay, scratch that. All right, seeing no more questions or comments from the committee, thank you very much. We'll go to in support of Senate Bill 453. Seeing none, Las Vegas, to the phone lines, BPS.
If you would like to testify in support of SB 453, please press star 9 now to take your place in the queue. The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to opposition here in Carson City, in Las Vegas, and to the phone lines. BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to neutral here in Carson City, in Las Vegas, on the phone lines. BPS, when you're ready.
There are no callers choosing to testify at this time.
Thank you very much. With that, closing comments, Ms. Hager. Okay, we'll close the hearing on Senate Bill 453, and we'll move on to Senate Bill 486. And this is Nevada Promise Scholarship and the Millennium Scholarship Trust Fund. Please go ahead when you are ready.
Thank you, Madam Chair, members of the committee. Eric Jimenez with the State Treasurer's Office, here to present Senate Bill 486. Broadly, the bill does two things. First, it appropriates $6 million to support the Nevada Promise Scholarship. For those of you who remember, this is a last dollar scholarship that applies after all other financial aid that is administered by NSHE. And then in Section 2, there is a $75 million appropriation to support the Governor Gwen Millennium Scholarship. I think it's incredibly important to note that the Governor Gwen Millennium Scholarship has helped 159,000 students go to and afford college affordably, and it is insolvent. So if we do not do anything here in this legislative session, we will not have funds to pay for Millennium Scholarship recipients in the full semester. This $75 million would not only cover the upcoming biennium, but would also cover the biennium following that as well. Happy to take any questions.
Thank you very much. And with that, any questions from the committee? Seeing none, thank you very much. We'll go to support for Senate Bill 486. Short and sweet, and you get an A+.
Short and sweet. Michael Flores from the University of Nevada, Reno. We are in strong support of SB 486.
Good morning, Alejandro Rodriguez, Nevada System of Higher Education, and she's in support of SB 486. Thank you.
A+. We're on a roll. That'll be your only one, Mr. Flores. Go ahead, Dr. Irvin, when you're ready.
Kent Irvin, Nevada Faculty Alliance. We are in support. I'm old enough to remember when Millennium first came in. Our students improved, and the students we were getting were at a higher level because students started staying in state. And although the value of Millennium isn't quite as high after inflation, it's still really important. Thank you.
Thank you very much. Any additional support? In Las Vegas, Las Vegas, is there anybody? Not seeing anybody? We'll go to the phone lines, BPS, in support for Senate Bill 486.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go in.
One moment, Chair.
Yes, sir.
There are no callers choosing to testify at this time.
Thank you very much. We'll go to opposition here in Carson City, in Las Vegas, and on the phone lines, BPS, when you're ready, in opposition.
If you would like to testify in opposition to SB 486, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. And we'll go to neutral here in Carson City, in Las Vegas, and on the phone lines, BPS, when you're ready.
Good morning, Madam Chair. This is Dora Martinez. I am actually calling to support. May I please proceed? I'll be quick, like everybody else.
Yes, please go ahead.
Okay, thank you. Madam Chair, we wholeheartedly support this bill. When I came here 15 years ago with my twin daughters, they graduated 2013 and they got the Millennium. One of them is now a manager at Jamba Juice in Hawaii. She has a wonderful life, and due to the Millennium, and her twins are having a successful future. So please, we encourage you to support this bill. Everybody will have the nice American dream. Thank you.
Thank you very much. Any additional BPS in neutral?
There are no callers choosing to testify at this time.
Thank you very much. Any closing comments? Okay, with that, I'll close the hearing on Senate Bill 486, and we'll go to Senate Bill 454, Office of the Governor.
Madam Chair, members of the committee, Daniel Marlowe, Administrative Services Division, Department of Administration. SB 454 makes appropriations to the Office of the Governor for replacement of certain equipment, computer hardware, associated software, and licenses to upgrade the computer operating system. We have no revisions, and most of these follow the standard schedule.
Okay, thank you very much. Any questions? Okay, seeing none, thank you very much. We'll go to support for Senate Bill 454 here in Carson City, in Las Vegas. We'll go to the phone lines, BPS, when you're ready.
If you would like to testify in support of SB 454, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. Opposition here in Carson City, Las Vegas, and on the phone lines, BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to neutral here in Carson City, Las Vegas, BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Mr. Marlowe, any? Good, perfect. Senate Bill 454, we'll close the hearing, and we'll open the hearing on Senate Bill 458. And that is the Office of the State Treasurer. Go ahead, please, when you're ready, down in Vegas.
Thank you. Good morning, Chair, members of the committee. For the record, this is Kirsten Van Rye, Chief of Staff for the State Treasurer's Office. Senate Bill 458 makes an appropriation to the State Treasurer's Office to fund replacement computer equipment per the EATS recommended replacement schedule.
Thank you very much. Any questions by the committee on Senate Bill 458? Seeing none, thank you very much. We'll go to support here in Carson City, in Las Vegas, and on the phone lines, BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to opposition here in Carson City, Las Vegas, BPS, on the phone lines when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. And we'll go to neutral here in Carson City, Las Vegas, on the phone lines, BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. Any closing comments from you down? Okay, thank you very much. We'll close the hearing on Senate Bill 458, and we'll open the hearing on Senate Bill 459, which is the office of the governor. It looks as though.
I think it's
Off.
So they had to put the bill in, but it'll be on the treasurer.
Okay, well, whoever wants to present on Senate Bill 459, come forward.
Kirsten Van Rye, Chief of Staff down in Las Vegas.
Thank you very much. Go ahead, please.
Thank you, Chair and committee members. Kirsten Van Rye, Chief of Staff for the State Treasurer's Office. For the record, thank you for allowing me to be here today to present Senate Bill 459. Pursuant to NRS 617.1675, the State Treasurer is responsible for administering the Silicosis and Disabled Pension Fund. This account was established in 1975 and provides silicosis and disabled pension fund benefits for diagnosed employees, their dependents, widows, widowers, surviving children, or surviving parents pursuant to statute. Silicosis is a form of occupational lung disease caused by the inhalation of crystalline silica dust and is marked by inflammation and scarring in the form of lesions of the lungs. The money in this account can only be used to pay benefits for the beneficiaries, and neither the Office of the State Treasurer nor the insurance company responsible for administering the payments is eligible to receive money from the fund. We estimate the annual payments for this fiscal year to total approximately $18,500, and Senate Bill 459 requests $35,000 for the next biennium to continue payments in accordance with NRS 617.168. Over the previous 6 fiscal years, the annual payments have averaged $25,542 total, with a year-over-year decrease of approximately 8.18%. The most recent numbers show that the fund was paying 13 unique beneficiaries, and I'm happy to take any questions.
Thank you very much. Are there any questions on this particular bill? Seeing none, thank you very much. We will go to those in support in Carson City, Las Vegas. On the phone lines, BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to opposition here in Carson City, Las Vegas. On the phone lines, BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to neutral, Carson City, Las Vegas. On the phone lines, BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. Do you have any closing comments?
No, thank you, Chair.
Thank you very much, and I'll close the hearing, and we will open the hearing on Senate Bill 460.
Good morning, Madam Chair, members of the committee. For the record, James Smack, Chief Deputy Controller, presenting on behalf of the Controller's Office for Senate Bill 460. This is an appropriation of $1.98 million to replace our current debt collection system with a more modern solution. I believe the breakdown on that's about $1.6 million for the solution itself, and approximately $400,000 for the support for two fiscal years. I'll be happy to take any questions.
Thank you very much. Any questions on this particular item? Thank you very much. And we will go to support for Senate Bill 460 here in Carson City. In Las Vegas, on the phone lines, BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to opposition here in Carson City. In Las Vegas, on the phone lines, BPS, when you're ready.
The public line is open and working. There are no callers at this time.
Thank you very much. And we'll go to neutral here in Carson City, Las Vegas. On the phone lines, BPS, when you're ready.
There are no callers choosing to testify at this time.
Okay, thank you very much. Any closing comments? Perfect.
No, Madam Chair.
All righty. Thank you very much. And with that, I'll close the hearing on Senate Bill 460, and I'll open the hearing on Senate Bill 461. Go ahead when you're ready.
Thank you, Madam Chair. James Smack, Chief Deputy Controller for the record, testifying or presenting on Senate Bill 461 on behalf of the Controller's Office. This is a replacement schedule of different server equipment, computer equipment for our office that is in line with the EAT schedule, and I'll be more than happy to take any questions.
Thank you very much. Any questions on this particular item? Seeing none, thank you very much. We'll go to support in Carson City, in Las Vegas. BPS, phone lines, please.
The public line is open and working. There are no callers at this time.
Thank you very much. We'll go to opposition here in Carson City, in Las Vegas. On the phone lines, BPS, when you're ready.
There are no callers choosing to testify at this time.
Thank you very much. And we'll go to neutral here in Carson City, Las Vegas, and on the phone lines, BPS, when you're ready.
There are no callers choosing to testify at this time.
Thank you very much. And I'm guessing no closing remarks. And with that, I will close the hearing on Senate Bill 461. Okay, we did it. All right. Now we will go and do a work session on two bills, Senate Bill 290 and Senate Bill 367. And Mr. Thorley, when you are ready.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. Senate Bill 290 was heard on May 11th in this committee. It was presented by Senator Cannizzaro. The bill establishes provisions governing the practice of earned wage access services and requires the Commissioner of Financial Institutions of the Department of Business and Industry to license, regulate, investigate, and sanction employer-integrated earned wage access providers. There was a fiscal note submitted by the Department of Business and Industry. It is a revenue-only fiscal note, indicates that the bill, if passed, would increase the revenue collected by the division because there'd be a new licensing type. The division also confirmed to fiscal staff that they would not need additional resources to carry out the provisions of this bill, and that they could absorb the workload with their existing staff and resources. There was an amendment presented by Senator Cannizzaro. When the bill was heard on May 11th, the amendment was in a conceptual form. There is now a proposed mock-up that is available on Nellis. If you want to look that up, it is proposed Amendment 3664 to Senate Bill number 290. The amendment is, the mock-up is identical to the draft that was presented when the bill was heard. The only difference is just moving some language around into different sections of the bill to conform with legal's drafting standards, but otherwise it is the same. I will briefly go over the amendment. So the amendment defines the nationwide multi-state licensing system and registry, and then adds sections 10.1, 13.1 through 13.3, and 18.1 to enact the provisions to govern the licensing of providers through the nationwide multi-state licensing system and registry, developed by the Conference of State Bank Supervisors and the American Association of Residential Mortgage Regulators, and operated by the State Regulatory Registry, LLC. Happy to answer any questions that the committee members might have. Again, there's the only fiscal impact is increased revenue of this bill. And if the committee wishes to move the bill with the proposed amendment, the proper motion would be to amend and do pass.
Thank you very much. Any questions on this bill? Okay, I have an amend and do pass motion by Senator Harris, a second by Senator Wynn. Any discussion on the motion? All those in favor say aye. Aye. All those opposed? Seeing none, motion passes. Thank you very much. And I'll give the floor statement to Senator Cannizzaro. Go ahead, please, Mr. Thorley, when you're ready.
The next bill is Senate Bill 367. This bill was heard in this committee on May 12th. The bill provides that for purposes of prosecuting a violation of provisions prohibiting certain persons from owning or possessing a firearm, each firearm owned or possessed or under the control or custody of such a prohibited person constitutes a separate violation of the law. Additionally, the bill sets forth the conditions under which the records of a child and who has been ordered admission to a mental health facility must be provided by the court to the Central Repository for Nevada Records of Criminal History for use in performing a background check relating to the purchase or possession of a firearm. The Central Repository must ensure that such information is included in the National Instant Criminal Background Check System and may take steps to include the information in appropriate databases in the Nevada Crime or the National Crime Information Center. These provisions do not apply if the child has sought mental health treatment voluntarily. A person who is a subject of a report made under the provisions of this bill may petition the court to have the report removed upon certain findings being made. Effective date of the bill is July 1st, 2023. The Department of Public Safety submitted a small fiscal note indicating a cost of $34,000 in FY24 for IT upgrades to their NCGIS system, or Nevada Criminal Justice Information System. They do have funding in their budget for that system, not for this specific purpose, but they do have ARPA funding in the budget as they are making upgrades to that system right now. There was testimony provided in support from the Nevada District Attorneys Association and the Las Vegas Metropolitan Police Department. No testimony in opposition or neutral. No amendments that I'm aware of. If the committee wishes to move this bill, the motion would be to do pass.
Thank you very much. Any questions on this bill? I will take a motion for do pass. Senator Harris, second from Senator Nguyen. Any discussion on the motion? All those in favor say aye. Aye. All those opposed say nay. Nay from Senator Titus. And with that, motion passes. Thank you very much. And the floor statement will go to Senator Cannizzaro. All right. That brings us to the end of this agenda. The next agenda that was posted for today was call of the chair. I'm going to give everybody about, 15 minutes. Okay, before we go any further, I've got to do public comment. So is there any public comment here in Carson City? Any public comment in Las Vegas? Seeing none. Any on the phone lines? BPS when you're ready.
If you would like to provide public comment, please press star 9 now to take your place in the queue. The public line is open and working. There are no callers at this time.
Thank you very much. All right. right, now we'll go back to, I sort of feel like I want to say ollie ollie oxen free. So if you're listening and you are on the next agenda, which says call of the chair, this is the call of the chair. So I'm going to give everybody 30 minutes because I'm going to give those people time to get here. So if any of you are listening or in this room and you have friends, tell your friends that the next meeting will be at 10:30, and be there or be square. All right, this meeting is adjourned. We'll see you at 10:30 for the next one.
Okay, we gotta go.